the 7th of April, we are excited to host another virtual event, Thriving in Adversity. A doctor is in our Tulips home. And this is also a continuation of today's movement's agenda in highlighting women's strength and success not only in the month of March, where we celebrate International Women's Day, but we aim to do this throughout the year. So stay tuned and follow us on our social media for updates. And today, we are paying tribute to Dr. Noor Hidayati Muhammad Sharif, a Malaysian frontliner who continues to fight the invisible enemy COVID-19 while serving double duty as a mother of two, caring for her family. She is currently a senior lecturer in the Faculty of Medicine, University Technology Mara, as well as a board-certified physician and nephrologist in Hospital UITM Sungai Buloh and Puncak Alam in Selangor. And this session today is hosted by our very own remarkable, wonderful Dato' Alia Karun, advisor for Tulips Movement, as well as the co-founder of the Health on World Foundation. So now I would like to pass it over to Dato' Alia to take over the session. Over to you, Dato'.
Thanks, Hui. Thanks. It's an honor and a pleasure. And yes, it's today is World Health Day. Thanking you in advance. Sorry, Doc, I need to call you Dr. Ida because I'm so used to calling you Dr. Ida.
Okay.
So please grant me the permission to continue today with Dr. Ida, right? Yeah. So Dr. Ida, firstly, thank you in advance. For your information, it is the first time that Tulips Movement is actually having a real life medical doctor in-house.
Okay.
Right? And on our platform, streaming live. Right, so to everyone who has just tuned in, welcome. It's a very special 1 hour and 20 minutes that if we're going to share with you. I'm Alia, and I'm in conversation today with Dr. Ida, as I fondly call her. Throughout the past few weeks that we have been chatting in preparation for today's event. Right, Dr. Ida, let me get the ball rolling. All right, so let me start. I think Hui gave you a very good introduction, but to me, I memorized it in such a way that I'm going to summarize it and say it in this way: that you're a mother of two, you have a 2-year-old and you have a 9-year-old, both girls, right? And you've been a doctor for the past 16 years.
Okay,
I know. Now I do the math.
From 2005.
Yeah. So okay.
Yeah, just about 16 years.
Yeah, so you've been a doctor for about 16 years. But throughout, for me personally, knowing lots of doctors, I'll say in a very short span, 16 years is not long when you say you have been jumping from an MO, right, to a hospital, and then you became a specialist in internal medicine. And 2 years ago, congratulations, you became a nephrologist.
Yeah, finished my training.
Yes. So for those of you who are trying to Google, she's basically the kidney specialist, right? So and you are also lecturing.
Yes.
You are the lecturer at the UITM, right? And you're also at the hospital at UITM while overseeing the new setup for the hospital in Puncak Alam, both located in Sungai Buloh. Did I get that right?
Yes. Cool. Puncak Alam is basically our new UITM hospital.
Right.
We just opened our doors actually this week.
Okay.
With our clinic service. We haven't started our ward or emergency department service yet for now. We plan to be fully open by hopefully the end of the year. We still have lots of things to do, lots of things to set up. So this year, that's basically my current project right now. Basically, managing the setting up of the new nephrology service in the new hospital.
How many chairs are we looking at?
16.
Oh, wow. Okay,
I'm like, they're really giving me 16, but I'm still hoping that we get more staff so that really can utilize these 16 chairs.
Yes.
But for now, most probably I will open a few chairs first and see how time goes, because we will be opening wards as well. So
we need
Yeah.
to reserve some ward for inpatient dialysis as well.
Fair enough. True. Doktor, soalan cepu Mas. Vaksin dah ambil dah?
Yeah.
Both?
I think I'm basically 1 week and a half after the second dose.
Ah, right. So you're
So
way ahead because I know of frontliners who haven't even taken the first one. Yeah,
yeah,
especially private
this is
doctors.
what I'm very like disappointed.
Yes, I
I wish
know. I've got
I
some
wish
friends who are in private who are actually getting their first jab only tomorrow. First jab,
yes.
right?
That's
Yeah,
that's the worrying part. The how it's roll out, and I have a lot of my friends in private sector who haven't
yeah,
had their first jab. Even ones who are in KKM also, some of them uh were not prioritized because they feel
right.
that they are not in the frontline divisions, so that they were given much later dates for vaccination. But I just hope that all of the frontliners will get their vaccination, not just the healthcare frontliners. I do
Yes,
think the education frontliners,
correct.
especially now the schools are open, they
Yeah,
should be getting the vaccines as
yeah.
soon as possible.
Yeah, we should prioritize, I think,
Yes,
especially those who are dealing with the public and kids, yes,
yes,
because,
kids.
yeah, that's the easiest cluster to have, because kids don't know about social distancing and you can't blame them, right?
And they get it from the adults actually, and then they pass it to each other, and then they pass it to the adults at home. So that's why I feel that we really need to step up with vaccinating our education frontliners.
Right. With so many things that you're doing, trying to set up a new wing or a hospital, mother of two, wife, daughter, lecturer, specialist. Do you have time for hobby? Do you have a hobby?
I do.
Cycling, are you?
No, I'm not cycling. I read. I'm
Ah,
an avid reader. But nowadays, right, because the surprisingly because of COVID, right, I lack more free time. So now I listen to more audiobooks, especially when you
right.
drive to work.
Yes.
And I switched to uh, uh, ebooks nowadays more, so that it's more accessible on my phone. Whenever I have like short periods of time in between, I just indulge on my books.
Okay. Now let's get into the crunch of today's conversations and today's topic. I'm going to ask you to rewind 1 year ago. It's about I would say about 13 months ago. Let me tell you first, from a point of a man of the street, like people like us, or all those who are watching. What happened to us 13 months ago was we heard that there was a virus. We knew that something was going on, and we got a 2-week holiday for the first instance of
First cluster.
getting, yeah. So the getting the information across to us was, I think you need to stay at home for 2 weeks, let us control. And of course, 2 weeks went on to another 2 weeks. So from what we understand in our homes, in our lives, we are not frontliners, we are not medical personnel, right? And this is what we heard, this is what we knew. But from your point of view, you're a medical frontliner, how did you cope, in the sense, like, you would have got first-hand information what this virus is about? How did you cope being in a hospital without, and everyone was doing extra long hours, and then there was also a scare because you have young kids at home, you have students, you have patients in the ward. What was it like for you? Tell me what you went through. What was it like for you, even with your colleagues, etc.?
Okay. As I work in UiTM Sungai Buloh, which is we are basically a stone throw away from Coastal Sungai Buloh, and I used to work there too. So a lot of my friends are the Hospital Sungai Buloh ID physicians and whatnot. So we are very up to date with whatever is happening with the COVID front.
Right.
And actually, early last year when the COVID pandemic first started in China, uh, we already been anticipating that it will hit our country in, like one time or another. So we were like, we already started preparing even early that year, and we are already when the first wave, we had it from the Chinese tourists, and it hit Singapore first, and then Malaysia. So we know it firsthand. So during that early period, there's a lot of things that were ongoing at the back. We don't share it with the public, and we had to actually set up what is our COVID protocols, what we do if any of the COVID patients land to our side, how we transfer. So this is what we started out first. So when MCO starts, for the rest of the people, you guys had to stay home, but for us, it's actually still work as usual.
Yes, correct.
So my struggle at that point was, I still need to work. Who's going to take care of my kids? Because daycare is down, school is out. My husband is also a full time. He's not a frontliner, thankfully. So he managed to get relief work from home during that period. So, and I had support from my own family, and luckily my family stay nearby. So
Right.
so that's what tied me over through this difficult period. But for a lot of frontliners, this period was very tough on this because of the daycare situation. Because most of us, especially the ones with the kids, we don't know where to send our kids,
Right.
and some of them even like had to resort bringing our kids to hospital, which is not really a good thing.
Yes.
It's actually not allowed actually, but
Right. No
we had
choice.
to set up like macam makeshift
Right.
daycare in the
Right.
hospital and
Understood.
our university campus, so that at least because that's why we were hoping that they were announcing policies for the frontliners so that some daycare can be open to accept the frontliners children, but somehow last year
Yes. Yes.
nothing of that sort. So that's really disappointing, and but we chose this line of work, so
Right.
we just trudge on. But for a lot of people, for a lot of us, that's the tough part. And then when online schooling starts, a lot of us feel that we're like the neglectful parent who don't, because they our kids are left at home, and a lot of them, they don't have us to actually guide them with online
Right.
schooling. And a lot of the online schooling requires things like you need to send things through WhatsApp, upload
Right.
things, download
Yeah.
things, play video on YouTube. And for us who have a younger kids like standard one, standard two, especially the standard ones, because
Yes.
they basically are very new at the
Yes.
academic classes sort of work.
Well, it was
So
also very new for them going online schooling. I mean,
yes,
no one has expected. I mean, throughout our entire schooling, we never went online schooling,
no,
isn't
we
it?
never.
So let alone kids at standard one and seven and eight, and yes, and you had odd hours working, right?
Yes,
So I'm sure, yeah, that was also another major challenge that you had,
I can only help my kid after work.
right?
So a lot of her assignment, especially the ones that she's weak in, like Bahasa Melayu, she needs like, Mom, wait, when are you coming back? Yeah, I'm coming
Right.
back. And then
Okay,
I need to
yeah.
sit down with her just to do her karangan, whatnot, because she'll be like, Mama, I don't understand this. I asked her to like next time Google Translate. But
That's
somehow
a shortcut.
my kids, I think a lot of frontliners kids end up being very independent because of us,
Independent, yeah.
our
Yes.
nature of work. So but I do feel that there should be a better way, maybe like I have friends in Australia where when they had to go to lockdown, although the school is closed, they actually kept some classes open for the frontliners children.
Right.
So
Okay.
that's why I was
Ah,
like, I was wondering if we
yes.
can
That
have.
was that was that actually that was a fantastic idea because you could have, help the frontliners by actually sending them not probably not even to learn, but at least a safe place,
Yeah, just
right? Yeah.
some like not transit lah. I mean like
Yes, I know.
some just to look out for them so
Yeah.
that they can do their online schooling in a safe place, and there are maybe some adults that can help them with like juggling with the technology part of the online schooling, that sort of thing.
Yeah.
Because
Got it.
and also I think that's the difficult part for the past 1 year. And I was and after and at one point I was trying to cope, and then I was asking for my friends. So basically, we try to pool our resources together, try to help each other. That's how us frontliners is lah. I mean, like, we, because we know that if we cannot help, if people cannot help us, we're the only ones who can help each other. So I have friends who actually like pool money so that they can get one babysitter neighbor to take care all of the kids
Okay.
together. And then we pool for, like, we have like classes tuition for our
Right.
kids
Okay.
also.
So there was a lot of juggling, right? But I'm going to take one sentence which you said just now. Let me quote what you just said, right? So you actually said this is the line of work that we chose.
Yeah.
Okay. So based on that line that you have just said, tell me honestly, I know it's not going to be an easy question, but I'm going to ask anyway. Can you tell me from an emotional point of view, a physical point of view, and a mental point of view, which was the most challenging for you, mentally, emotionally, and physically? Which was the most challenging for you?
Honestly, mm, honestly, trying to be strong mentally throughout the period, um it's not much physical labor, it's more of mental, especially
Right.
the part where a lot of us frontliners, right, we always in danger of getting exposure.
Right.
So that's the part that we are always afraid of, and that causes greatest anxiety, which is bringing back COVID from hospital back to our house,
Yes.
and any of our children get infected, and or our elderlies, our parents. One of my colleague, her father contracted COVID. So she was so he was like, did I brought it home, and wasn't I vigilant enough with my precautions, whatnot. So that's the part that is both mentally and emotionally challenging for us. And especially when we had to go to quarantines, whenever we get exposed. Yeah, I have a few friends who had to go in and out of quarantine
Quarantine. Yes.
exposure, and they had to be isolated from their kids and their husband, spouse, their family. So, and one of my colleague who ended up getting COVID had to be admitted, and along with the rest of the family. So it's that's the part that is actually much more very taxing.
Right.
That, and another challenging mentally part is a lot being woman, right? You a lot of multitasking, and
Yes.
so during the COVID period, right? I feel the mental burden of this multitasking actually grow more, and you need to like multitask with your front your work at hospital as well as the work at home, and on top of it you need to manage your own self-care
Right.
on top of it. I honestly feel that trying to put in some self-care, which that was one of the things that helped me to survive this period. If not, I don't think mentally I can last
Did you
throughout.
read anything? The reason I'm asking whether did you read anything or did you depend on anything? Of course, besides, I think a lot of people went back to, being worried, and, the Holy Book of Quran, or whether church or other impactful values people were holding on to. But the reason I asked whether you had read anything is because there was a question that was popped up by our friend online this afternoon, Patpal Singh, who wanted to know whether are there any such books that have come out to help you as a frontliner, or even us understanding what's going on, giving you that reassurance of, and a little bit more mental emotional stability, I would say. Is there anything out there for people to grasp and read?
Um, Honestly, I don't read that kind of books. I read fiction a lot. I find it is a lot of I find it a lot of escapism.
Right.
uh,
Well, COVID was one of those fiction things that we thought had come in, right? Because a lot
I
of
think I read more like like social dystopian kind of stories nowadays.
right. Okay.
Just to so that it's not too bad our current situation. This is
You're
worse.
you're you're trying to stay positive, aren't you?
Yeah.
Yes, I know, because I think we've all been in touch, like personally for myself as well, with having so many doctor friends. I think it was, it only hit us much, much later. But I tell you something, and, kudos to you and the entire team of frontliners, is because the last 1 year, everyone seems to understand and know the word frontliner has been the word in our dictionary, right? And appreciating frontliners is something that we probably had taken for granted much before, but a long time ago, but never took frontliners for granted ever since this COVID hit. I mean, we've been hit by SARS, we've been hit by malaria, other things, but I would say this was the biggest scare that had happened. Because it was a very unprecedented thing and obviously very new even to the medical fraternity, right? So you guys were not did not know what you were handling either, and and the other thing that probably why I would say, and I will let you add a little bit to it, is the impact of social media, the impact of advertisements and support of you know mother and kid can't even like hug, or can't even come near because you have not taken a shower, and things like that, and non-stop working in hospitals. And I think that a lot of us shed tears when we watched such instances. Did you have any of these challenging instances which I have just said? Did you witness this? Did you go through it? And
Um,
share a little.
frankly,
Yeah.
frankly, because I'm a nephrologist, so I prefer to prevent getting into contact. So
Right.
honestly, I send my minions to go see the patient instead of me going to see
Right.
themselves. But yeah, I know my MOs. My MOs are actually the
The
actual
true
heroes,
heroes. Yeah.
the really really true frontliners. And I'm basically the in between, like guiding them. And I do feel that the really true frontliners is the one who really in contact with the patient, taking care
Right.
directly, which is the nurses, also the cleaners,
Right.
those. Because I always feel that when we talk about frontliners, there's a lot of like focus on doctors,
Yeah,
but
but it's more
not
than
enough.
that. Yeah.
It actually frontliners for COVID, right? It it covers more than that. It's the economic frontliners who continue to work throughout the pandemic. I don't think we can survive this without the Grab
Yes.
riders sending us for food.
Correct.
Seriously, I mean, like during the first MCO, right? None of the shops are open.
True. True.
I was
True.
like,
Yeah, you
uh,
were very dependent on people.
yes, and I was like, I think the whole ward had to like find ways to get lunch. So and we because most of the shops are closed, and we had to pull so that we can pull our orders so that one shot get the delivery together.
Mm.
And then I think at that point also the teachers, although a lot of people say that they are working from home, they basically having extended leave. No, really, I think the teachers also like this is new. I think like teaching over Zoom,
Yes.
online schooling is new
True.
to
True.
them also. And
Yeah.
I think we witnessed a lot of creativity among the teachers
Agreed.
coming up with at over a short period of time, like
Yes.
really innovative
Yeah.
ways to actually teach our children. Although I do think that it's not all teachers, but I do see a lot of the marvelous things that I've seen from the education frontliners. And but
But you also have the janitors and the cleaners, and yeah, yeah, because I think they did a fantastic job as well
yes,
to support. Yeah, and they were actually forgotten sometimes. So you're absolutely right in saying, that everyone was focusing very much on the DG, on the doctors, But yes, there's this huge and humongous team of people actually who, like what you
It's not
so
it's not
rightly put
just the
out.
doctors, to be
Exactly,
honest.
right.
Mm.
As frontliners. Doc, if I,
Because
if I,
COVID, right?
yeah,
It
go ahead.
affects everyone, not exactly just the healthcare actually. And the lockdown that ensures after the COVID pandemic start also actually impacted a lot of people beyond the healthcare side as well.
Yeah. Now I need to ask you, if I'm not mistaken, I mean you're a person who tweets, right? So I
Yeah.
silently follow you. Haha. So I would ask if I'm not you're very safe in my tweet. If I'm not mistaken, you actually, if I'm not mistaken, yeah. So correct me if I'm wrong. You actually tweeted that you had lost a nurse or something, somebody, right? A couple of
My my sis my CCU
matron.
nurse, no, she's not a matron, our sister, what sister.
Right? What sister, right?
Mm.
So you
I
and
saw her 1 week before she was admitted. So it broke a lot of people's heart when she got admitted. She was pregnant some more, and so that's why have been very vocal about vaccination for the healthcare workers. And I do feel that that is the only way to keep our healthcare workers safe. Um,
how old was she, Doc?
she's, I think, early 40s.
Right. Okay.
Mm,
And she passed away due to COVID because I read your tweet that morning and
yeah.
yeah. So I was empathizing, as well because I felt from your tweet. I would tell you this even though I didn't tell you then. I can see even now when you talk about her. I can see you. I can hear you, but literally I can feel you when talk about her and when you work with somebody and you lose somebody that has. Literally put their lives on the line to take care of others. So yes, so our condolences to her, the family, and to everyone who's been working with her. But besides her, you also probably I'm sure being in Selangor, looking at the numbers, being in a hospital very nearby to Sungai Buloh, you're also daily getting numbers that of people who are leaving us or rather deaths, right? How does that affect your team, your team, and the rest of the medical fraternity?
Um, honestly, when when we lost someone that is part of our team, the first thing that we we ask each other, "Are you okay? How are you doing?" I mean, to me, as a team, everybody is mentally and emotionally affected.
Right,
Um, especially since a lot of my when when my colleague passed on, we actually the when because a lot of us, it caught us unaware because she was well, and we always, all this while, right, we always think that it won't happen to us.
right.
Although sure, we have had some of our friends who got infected. One of the nephrologists got infected.
Yes,
um so when but when one of them die and someone is who are actually, it really hits you that what kind, because sometimes we take for granted, like, I mean,
yes,
like, you've been doctor for a while, right? You don't think that, oh, you won't get this, but it really hits you like how mortal you are,
right,
and how vulnerable you are. And and that's and we want, and sometimes when these things happen, we thought that, are we not taking enough precaution? We and I had to, like, keep my team up, saying that, no, you don't blame each other. uh we just relook whether there's anything that we can improve on and move on from that point, and ask if anyone needs more help mentally, get our psychiatry team on board to give us counseling and sort. I do think that's helpful for a lot of frontliners, especially whenever any of our colleagues got admitted, infected, especially if they are critical, was admitted in the ICU, whatnot. And those who are infected also, they basically, I know a few of my own friends who get infected, and when they recovered and they had to come back to work. So there's a lot of anxiety coming back to
Right.
work.
Yeah.
So that's another thing that I do hope that maybe somebody can shed more light on that, make people more aware of. Um, I do feel that when we say appreciate our frontliners, we should show it with actions rather
Right.
than
That's a
like
good point.
claps and whatnot.
Yes, that's a good point. Yes.
Yeah.
Yeah.
So I do feel that these is the things that our frontliners actually needed
Yes.
support more, which is not just free food is always appreciated, but
Yes, I'm sure.
things like that would make a great difference would be our mental support
Yes.
during this period, and as well as social support, especially for the women, female healthcare workers.
Right. Yeah, okay. For those of you who have just joined us or who's wondering, I am in conversation with Dr. Hidayati, or you would fondly hear me calling her Dr. Ida. You're actually on the Tulips platform, and we are discussing with her, paying tribute to the frontliners, and she as a woman leader in the medical fraternity, and hence we are having a conversation with her, understanding as we go along what's happened, and the questions coming up are more on her being a leader and a woman leader as such. And let's see if we can pick her brains a little bit more after this. But Doc, having said that, I think I'm going to ask you, I'm going to put you on the spot here and say the past 2 days we have been getting a lot of tweets, a lot of info that the fourth wave is coming right smack during Hari Raya, right? Because I think there's announcement or predictions. Let me get it right. On the fourth week to the eighth week, right? They're saying that or in 4 weeks to 8 weeks, you will actually see the fourth wave that's going to hit, and that has put a lot of people, including myself, very tensed, because we're just starting to go out and enjoy, ourselves. So, and then suddenly to hear, and a lot of people are saying, and doctors have tweeted this morning, I'm sure you know that. So, what are your thoughts on this? I'm not going to hold to say Dr. Ida said it. I don't think any one of us will hold you, but, what are your thoughts on this?
I honestly feel that for my mental well-being, I no longer follow the numbers.
Right.
Seriously, I think I've stopped following the numbers for the past, actually the past 1 year. I feel that the numbers is not reflecting what we have on the ground. I mean,
Right.
and people need to understand when we talk about numbers, we need to see it in terms of infection rate and vaccination rate at this current point. And our current vaccination rate is actually very
And
slow
low,
and
yes.
very low. And I feel that I don't know whether I'm allowed to say it. I do feel that lockdowns is not really foolproof. It always needs to go back to physical distancing, social distancing. And I do feel that in current situation, right, everybody should be safe, protective of themselves or their
Yeah.
family. And that's although and always don't ever think that this can't happen to you. It can happen to you. I think a lot of people thought that, oh, I don't know anyone who actually got infected by COVID. None of my family members or my friends ever get infected by COVID. Some even don't believe that COVID is real.
Yes, true.
My God, seriously,
Yes.
if you did see the patients that come with like the the chest X-rays that I've seen, the CT scans that I've seen of the lung, basically the lung is just mush. Um, you wouldn't say that this is not real, and the and people lose sight that the death numbers are
Right.
actually people
Right.
with
Exactly.
families,
Yes.
and people were like, "Oh, it's just 1,000 people that." I'm like, "What do you mean that just 1,000 people died?" I feel like
Exactly.
I want to slap you.
Yes.
uh,
Yes. Permission granted. Permission granted.
because seriously, even one death is too many.
Yes, exactly.
And if that death is a friend or a family, you wouldn't say that, oh, it's just 1,000
Exactly.
deaths. Why not we just open up the government sector? People are dying because the economy is dying. That's why I do feel that having lockdown is not truly the answer either. We should
Yeah.
step up our vaccination, do a very localized track tracing, screening and tracing,
Tracing, yeah.
and isolate those who are positive, and maybe a tighter quarantine for those who are actually exposed, because I I do feel that there is a better way to actually come out of this pandemic without hurting the economy or jeopardizing our own lives in at the same time.
If I
So
give you a magic wand, what would you do? What would you do differently?
what would I do differently?
Yeah, just take the magic wand and tell me what would you do differently? What would Dr. Ida do differently?
I would vaccinate everyone,
But
everyone,
unfortunately, we don't have
because
enough
magic one,
vaccines.
right?
Yeah,
I
yeah,
can
true.
I can automatically have enough
Right.
supply of
But
vaccines for
I'm glad you
everyone.
said that because it really emphasizes then that you are actually emphasizing the very importance of every single person being vaccinated.
Yeah, we need to vaccinate everyone, not just the vulnerable, not just the healthcare
Yes,
workers.
right.
And that's why I really worried, because we are not being fast enough. I mean, like, we're not vaccinating all of the healthcare workers at this
Yes,
point,
yeah,
at this current time yet, despite that we are starting phase two.
yeah.
Hopefully with phase two we can get
Catch
more
up.
people
Yeah.
on board. I've been actively telling a lot of my patients to register. A lot of people are not registering, not because they don't want to get registered. They were saying that, I don't have any comorbids, I'm not more than 60, why I should I register now? Most probably the earliest that I'm going to get vaccinated will be next year. I could. This is a friend of mine. So it's like,
Right.
I can't blame them. So they have a point there. But I do feel the reason why we all of us need to register from now is so that it will give a better idea how do we actually distribute the vaccines. Because as I do feel that everybody should know, although the government kept saying that we have enough supply, a lot of this supply haven't come reach our shores yet.
Yes.
And all this we have ordered, it's not here
Yes.
yet.
Correct.
So so with whatever mega supply that we actually have at this
Right.
point, we need to actually distribute it for the whole country. So this is actually a humongous task, and
Task. Yes.
I I do think that Datuk Khairi, not Datuk, right? He's
Yeah. Khairi
Mr.
Jamaluddin.
Yeah, our
KJ.
Menteri,
Yeah.
KJ, right? So is having this huge task to actually spearhead to get everybody's vaccinated. But
Vaccinated.
I do feel that we need more, like more.
Yes, yes. Okay,
So
I can feel that frustration, and I don't blame you because you actually see real life cases and you see patients, and you're lecturing and you're in the medical fraternity, you're in the medical background, and you get first-hand information. So to everyone listening in, okay, a few things that Dr. Ida has said is it's not about you staying at home, but it's about you being careful. It's about you practicing social distancing, and using hand sanitizers, washing your hands regularly, staying away from places or people that are ill and not
no,
safe, in other
well,
words.
not well ventilated. A lot of people forgot that the issue with a lot of transmission is like we getting like staying like very close. Um, a lot of buildings in Malaysia is not well ventilated. I think everybody
Okay,
knows that.
right.
We actually close the windows.
Yes,
And a lot of them, the only ventilation that we have is a fan, maybe a single
right,
fan.
right,
And a lot of clusters actually originated from like a food restaurants, because when you eat you open your mask, right? And then when you
right.
eat you talk, right? And so that's why I feel that and we need to improve on that. Maybe right, maybe not a total lockdown. We may still need can go out buy food from, but you shouldn't be like eating in the shops. Maybe just bring it back, eat it at
Right.
home.
Yeah.
Um, more keep the parks open.
Yes.
Let people have areas that they can enjoy it instead of staying indoors outside
Yeah.
at home. Um,
Being extra careful.
yes,
Yes,
and
being extra careful, and don't forget to register to get yourself
yes.
vaccinated. Yes, yes,
Even though you may think that your turn won't come out, but based on what KJ have been saying that they might actually opening it up
yes.
to anyone who actually registered at
Correct.
this rate.
They might,
And
yeah, they might actually speeden up the process.
yes,
And because I know of some smaller states that have, they might move even faster than the Klang Valley itself, since the numbers are smaller in smaller states like Perlis and Kedah, and even districts. Yeah, yeah. Doc, there is a question again from Purple saying about caregivers or your colleagues. You talked about mental stress just now, so he's interested to know what kind of signs or symptoms did you see, or did others see, or what kind of signs and symptoms did they have for you to actually know that, look, they are actually going through mental stress?
I find that people who are very stressed, they find it more difficult to control their emotions. They tend to lash out more, and especially those who are um, going to sign is I will call I tend to feel that it's more like signs of burnout, like mental burnout. They they would just like I cannot. They would be very agitated, easily agitated, very anxious, more easily irritable. That
Yes,
is
they
one of
snap.
the red flags that you
Right,
need to ask, are you okay?
right, okay,
Because or
yeah,
like change behavior. I mean, like a lot of people, right, when they are not stressed, they are in control, can manage whatever you throw them in a week, and they are very
yeah,
cool, chill people. But once they hit that point, their mental burnout, right, they become very easily angered.
right,
They lose their focus. They even make mistakes, which is not something that you want when
right,
you are
okay,
dealing with this kind of
yeah,
situation. Anyone, throw in the towel for good. Um, no one that I personally knew, but a lot of us, not really, not really. We don't really like say that. Oh, I want to resign. I don't want to be in.
right,
A lot of us, right, just end up like just taking leave. Uh, Despite we are actually a lot of our leaves are actually frozen.
right,
Then that's another
yes,
thing that contribute to our mental
yeah,
stress. Usually for myself, especially lah, I mean, I even before COVID, right? Because my line of work, I do have I I do practice for my own self care, mental self care. Take breaks, like go for staycations or short trips with the family just to recharge. So nowadays you cannot go anywhere.
true, true, true,
So I end up so what I a lot of us who most of us actually, right, when you become you work in this line, right, you yourself know that you are going towards burnout.
right,
So a lot of us have our own coping mechanisms. My coping mechanism is usually we go for a staycation. Maybe the kids will have like swimming pool time, and for me, usually I tell my husband, take care of the kids, just leave me alone for the whole day. I want to go do my hair, but
yeah,
cannot now. So that means
yes,
it's just me and a Netflix or a book. So
right,
so
okay,
that's how I cope when I'm heading towards a burnout.
yeah,
And um when the thing with stress, right, you really need to identify when you actually have it. A lot of
right,
people, right, they are stressed, but they either choose to ignore it or just they know they're stressed, but
In denial.
they're in denial. They're just, I'm okay, I'm okay. It's not. If you're not okay, just admit that you're not okay and do something about it. I do feel that's the key to stay resilient, uh, to survive this. I mean, I think it applies to every one of us.
Yeah.
A lot of us, we are surviving this.
Yes.
Um, Although I do hope that we can thrive despite of these challenges.
Yes.
But for a lot of people, it's actually enough to actually just survive this. We are not being judgmental. If for a lot of people that I know, because I work with trainees, a lot of researchers, academia, and whatnot. A lot of training opportunities and had to take a back seat. So like
Yes.
we had to forgo opportunities suddenly closed up. I mean, like I actually wanted to take up a transplant fellowship last year
Yes.
in Australia, but yeah, COVID happened. No one's going to go to Australia at this rate. Australia is closed to
Right.
everyone.
Everyone. Yes.
So a lot of people training had to be lengthened. They had to pause everything. So that's another thing that a lot of healthcare frontliners
Yeah.
had to deal with. A lot of uncertainty of their career pathways, because a lot of them, some of them had to be shift to COVID work when then that's not
Yes.
their actual pathway
Actual.
of
Yes.
interest.
Right.
So and so that's another aspect of the challenge that a lot of
Do,
frontliners.
do you see that now that they have adapted? This is with related. This is in relation to Hu Ying's question. You know, now that it's 13 months. You know, fast forward now it's 13 months. Do you see that they have now adapted much better, coping much better,
I
etc.,
do think a
etc.
lot. I do think a lot of people have started to adapt better. Even some training areas have been opening up. With
Opening up, yeah.
basically last time, right? People insisting that no, you cannot do like online training. Online training is not enough. We need
Yes,
to do have face to face. Never mind, pause everything. We can restart back in 6 months time. But yeah, the 6 months went by and
yes,
it's
yes,
still
and
in
everyone
lockdown.
adapted. Yes,
So
everyone pivoted
so
and
everybody
adapted.
was like, never mind lah, we do it online, it's okay. And then
Yes,
a lot I changed my outlook. I no longer aiming for a transplant pathway anymore,
right,
especially now. So now I'm just focusing what I have now. So basically
right.
I'm
Okay.
putting more focus on my team, my nephrology team, and my nephrology service at this point, and as well as I'm currently involved with a lot of medical education, and we in UITM we are coming up with a lot of innovation for online distance learning innovations for medical education, because medical education, right, it, you cannot really teach medical education without face to face and clinical.
Yeah,
uh
clinical especially they need the theory
yeah,
is one, but practical is more important
so
sometimes.
that is
Yeah,
our biggest challenge as a medical educator for the last 1 year. How do you actually give clinical exposure to the medical students
yeah,
but keep them safe? So that
yeah.
is one of our challenges as a medical educator. So we come up with a lot of innovative ideas. Uh, we building up our own clinical skills lab, uh, uh, trying to introducing a lot of technologies, and putting our new areas where last time, right, we don't use a lot of videos with our
Right.
teaching. So nowadays, right, a lot of
Yes.
the lecturers now all need to be like instant YouTubers
Yes,
nowadays.
yes. Very changgih. TikTok,
Yeah,
TikTok.
yeah, even like yeah, doing TikTok videos, because
Yeah.
nowadays the medical students are, I don't know what is zillennials, is it now?
Yes, yes,
Uh,
exactly. They've got new terminology again
yeah,
for these
I think like
people.
every
Yes.
decade they have new
Yes, yes,
terminology.
you're
So
absolutely right. Yeah.
I find that the current batch of medical students, they are much more responsive to the
Mm,
new tech
mm.
when delivering information and knowledge, and they have shorter span. They don't cannot
Spend,
stand
yes.
lectures 30 minutes online.
Right.
So that's another thing, another way, like just instead of taking a lot of people, when the pandemic happened, right, they thought that, oh, it is a waste of 1 year. We cannot do anything. But no, you just
Yeah, yeah.
need to refocus, find another area for you to do, and just do it. Don't 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 be too, how do you say, too uh I mean, like, too fixated what
Yes.
could have
Yeah.
been. I think a lot
Yeah.
of young people actually find the pandemic is bad because of that. They feel that, oh, this is my youth. My youth is wasted.
Wasted. Yeah. Never
uh,
mind. It was just 1 year. Yeah. Yeah, but that's a good point to note that you when push comes to shove, you needed to change, and you have no choice but to change and adapt and pivot and try new things. And I would say, looking around, many people were successful in doing it. And I think the success stories shared actually helped a lot of other people to embark on that same journey of, I need to move, I need to change, I need to try something new, I have no choice but to go online. And then also adapting to those changes to encourage the people to stay online, and from students to adults. So I'm sailing in the same boat. So I totally understand, coming back to school now and going online with lecturers. So yes, definitely. But Doc, having said that, while I let you take a breather and I let you have a sip of water, to all those who are joining in, welcome again. This is a Tulips platform, and what is Tulips all about? The Tulips team, and I thank you to the team. They have actually prepared a montage of about a minute for you to see what Tulips has been up to. I think the past 1 year or so, and in the event that you're interested to join Tulips in empowering the women and also youth, please reach out to any of the Tulips members that you see, all of us having the Tulips logo in our Zoom back end. So over to you, Nora, for the montage. Thank you. Thank you, Nora, for that. And thank you for the team at Tulips. Doc, as you are aware, and I've mentioned to you and to all those who have also tuned in today on our Tulips platform, we advocate and support a lot of programs involving women, and we also do some programs for the youth. But obviously, when Tulips started, Tulips is very new. It's a non-profit organization, and it started just 2 years ago, founded by a man, not even by a woman. Although you have a whole team of professional women on board, striving to do the best for the rest of the women. So let's come into a little bit of topic, as I regard you as one of the women leaders out there, especially in the medical fraternity, right? So tell me, there is always this same statement that goes around, that women are very, very emotional, that although they are very good multitaskers, men use more of the brains and the heart, women use more of the heart than the brains. What's the biggest challenge that you have faced as a woman in a world or in a fraternity where you have a very balanced ratio of male and female in the medical fraternity. So I'm very much aware of that. But tell
At least
me,
for nephrology, I think.
yeah. True. You got a point there. But you do see a lot of, I mean, we see a fair number of male doctors, female doctors. But when it comes to nurses, naturally we see more female nurses than,
Yes.
male nurses, or, HAs. But you see the back end, right? The back end of like ambulance drivers and all these other HAs and hospital assistants and the people who wheel you from one ward to the other ward, they are actually more male. So
Yep.
so I would, naturally say that there is a, balance. But when it comes to you, do you actually believe, is it a myth or is it real that women are more, emotional, and this thing about these statements that have been said over and over again, that women are more emotional, we think with our hearts instead of our heads. um, and you work with a group of male doctors as well. So, what's your thoughts on these kind of statements in passing? Passing statements that thrown out there. What's your thoughts on this?
Honestly, I work with a lot of men. I find men can be emotional as well. So
Cool.
I really need to differ on that point.
Right.
I do feel it's actually individuals rather
Yes.
than gender. Um, but having said that, is emotional is bad? I mean, I feel that when you speak with emotions, right, wouldn't you feel more empathy, more um I don't know. I always feel that those who we find like say that, oh, he's a good leader, don't follow emotional, they're very rigid and
Right.
they really hard to empathize. And sometimes when you are not showing much emotion, it's really hard to actually get support
Right.
and understanding from people around you, especially when you work in a team. And sometimes when we that's why I honestly don't really like people saying that, oh, being emotional is bad. I
Yeah.
feel that
Okay.
I feel that being what we need to be more of is like utilizing our emotions in a good way, in a positive way.
Right.
Means that recognizing negative emotions and that and work how and recognize, but when you recognize it, you know how to deal with it and manage it.
Oh,
um
that's a fantastic point, actually.
yeah, because I really don't really like people, because when someone told me, right, when women is being um forceful, talking emotionally, and but if a man is talking like that, oh, talking with passion,
Passion. Yes.
so I was like,
Yes. Yes.
oh, but if it's a woman,
Yes.
oh,
They're
she's
being very
talking
emotional.
emotionally, she's very
Yeah.
emotional. And I was like, but if a man talk the same way, oh, he's talking with passion. So
Yes.
I do feel that I do feel that there's a lot of people who still have this mental fixation with gender roles,
Right.
then that box how they view genders, like leaders according to
Right.
gender. So that's why I always feel that it's not really individual, it's how we see men and women as a leader. So and what we actually believe a woman leader would be, or a a man a man a male leader should be. I really like leaders like macam uh, the Germany chancellor. She's always been taught as not emotional, and
Okay.
they thought that is a positive aspect of her being a leader, not being emotional. But when she was handling the COVID, and she's actually a scientist, with a scientist background, and when she actually talked about she and finally she was like talking about anger, the way that people are like hoarding the vaccines from countries, whatnot. She's commenting on that. uh People were like, oh no, she's emotional. It's like, that is
She
such
was
a
stating her point of view. Yeah.
just for stating her view on that
Yes.
point. And when she is attacking, not really attacking, she's
Yeah.
criticizing those who are actually against lockdowns and whatnot, and she feels that scientifically is something that we need to do. And uh having masks apa tu being apa tu um mask mandatory for.
Mandatory to wear masks. Yeah.
So, and people were like, why are you being emotional? This is
Yeah.
not big and whatnot. And people trying to like macam, in a way, right, I
Play
feel that
her
she's
down.
being
Yeah.
gaslighted.
Right.
And even when Jacinda Ardern, the New Zealand
Yes.
president, also
Right.
when
Yeah.
she started uh, uh, when she started, we put her New Zealand lockdown with one, two,
Yes.
three cases, and we were like,
Yes.
these leaders, right, female
Yeah.
leaders, right, they're very emotional. They just, lockdown, lockdown. They're
Yes.
very scared, very anxious.
Yeah. But
But
on the contrary, yeah, on the contrary, she was one of the best leaders in
yeah,
the world.
they
Yeah.
did. I do feel New Zealand's pandemic response was remarkable,
Yes.
uh, and I do feel that it is her leadership that actually spearheaded uh, that response, and that actually, and I do feel that that's why I do feel that it's actually individual leadership. It is not. It doesn't. It's never about gender. It's actually individual.
Yes.
If you're a good leader, no matter what gender you are, you can be an effective leader. Uh, I do feel that both of I give these two as example because I find both of them are very science based with their approach for the pandemic response, which is I do feel that is how we should deal with the pandemic. Um, if we want to say emotional, maybe I say the previous president, the American president Trump
Yeah.
was very emotional.
Correct.
He is very
Very
emotional.
emotional. Yes. Yes. Yes.
So that's
True.
what I feel when we talk about being when we talk about saying that women are being emotional. I do feel that it depends on how you see things.
Right. So the 2021 Women's International Day theme is actually choose to challenge. Basically, we are challenging against biasness and also gender inequality.
Yes.
Now, as much as I hate to admit it, obviously for them to choose that theme, this must be quite it must be happening quite prevalent in countries or within United Nations has supported this choose to challenge as well this year for United Nations women, right? And SDG 5 is actually gender inequality. Tulips plays a role with SDGs and in support of SDG 5 in particular for gender inequality. Now, coming back to you in your career, were you ever robbed of any opportunities or chances because you were a woman, or did you have to take any back seat because you married and wanted to become a mother? So, did you have any of these challenges? Were you robbed? Dirompak?
I
In
need to
that
give a
sense?
thought about it.
Yeah.
I do feel that whatever you do in life, right, you choose, and it depends on what priorities you have, what situation you have. I know a lot of people who didn't go for certain pathways because they don't have support.
Right.
And I do think that I'm lucky. I have a very supportive husband who actually had to take a back seat of
Right.
his career when decided to pursue subspecialty training. And I always told him that once I reach this certain stage, I'll let you. Currently, we are doing that part actually,
Right. Okay.
so it is actually his turn now. So
Gender
he's
balance. This is gender
yeah.
equality, not inequality.
Because I don't know whether you have read Michelle Obama's
Obama's book,
Becoming.
Becoming. Yes. There's also
And
it's also on Netflix.
yeah, so and especially if you read her husband's uh, memoirs, there's a lot of
Yes.
um when because Michelle's career was at the top when Obama suddenly decided to actually
Run for office, yeah.
run for office and Senate. I think initially it was Senate or
Senate,
something.
yeah,
Yeah.
Senate.
So and she was like, she had to step back for her career, and there's in her memoir they actually talk about it, and she always feel that in marriage there's equal partnership, and that's what I believe too in my marriage. So both of us feel that both of us have potential to go, and we should try to maximize that potential, but no one should take the backseat to the other person. Both of us should thrive. But if we cannot thrive together, maybe we take turns. I do. That's another reason why I actually decided not to take up the fellowship
Fellowship, yeah.
pathway anymore, because I feel that if I have to do that, then that means he had to take another 1 year off from his work and maybe follow me for the fellowship. Uh, uh, and so that's why I told him, right, maybe it's not, maybe it's not meant for me, and maybe
Maybe not at this time.
yeah. So that's why to me, right, I always feel that when people say you are robbed of an opportunity, maybe the opportunity was never yours to begin with. So I always feel that if you don't fixate with things that you didn't get, maybe
Right.
like you need to see what you have now, what
Okay. So
you
appreciating what you have rather than complaining of what you didn't have or you didn't
yeah.
get.
I
Right.
mean, I do find it more productive in that sense rather than because I know a lot of people who actually miss a lot of opportunities because of the pandemic. I know a few of my younger relatives who had cannot go for their overseas university offer because of COVID, and they had to delay. Some of them, yeah, SPM got delayed, right? So it's
Yes.
like,
Yes, correct.
so a
Yeah.
lot of missed opportunities, but that's why I tell them, why not just see what you can do now? Maybe okay, now you cannot go to university now. It's okay. Maybe look at maybe what kind of training online you can do or what you can learn. Maybe take 1 year of learning new languages or
Yeah.
something.
So
But
yeah, that's actually a very, very good advice. Instead
I
of
do
doing
feel that
nothing
that's
and
more
keep harping on it.
productivity. It's not harmful. I always feel that fixating with something that you lost or thing that you get robbed of is not a really healthy thing.
Right. Okay. So it's how you look at it, a glass half
Yeah.
empty versus a glass half full sort of a scenario that I know it keeps coming to my mind when you're saying that. I am actually thinking you're very looking at the other way, and instead of saying the glass is half empty, you actually saying the glass is half full. But when we talk about women and leadership, do you have somebody you look up to? Like if I asked you about woman leadership, a charismatic woman leader, who comes at the top of your mind?
Prof Adiba.
Seriously?
Because I work with her.
Ah,
She
right. Okay. Yes, yes.
uh
She's a iron lady in the medicals
yeah,
in UMMC. She's the dean,
yeah.
right? Yeah.
I Is she here? Okay.
No, she's not.
But because I've worked with her, so I really do feel that I really respect her work ethics. She really believes in balance, work life balance, and she really have very clear vision of what she wants for the faculty, for the field of medicine, especially for infectious disease. I originally wanted to do infectious disease because of her.
Ah. Oh, okay.
I changed my pathway. She still asks me whether, you are okay, you doing okay with your current pathway. I always feel that, I disappoint her in a lot of ways. One of it like not
Ah.
doing infectious disease at the end, but yeah, I always feel that maybe is I have maybe I was meant to do something else. I don't know. So that's why. But I still idolize her. I still feel that she's somebody who I actually not I want to emulate.
Yeah.
So because I do find her vision for her field, and especially her, she has because when we talk about emotional leaders, right, I do find people who are in touch with their emotions have the greater empathy, and I always feel Prof Adiba is someone like that. And especially when she worked with the HIV prisoners.
HIV, yes, she was the
Yeah,
president. Yeah,
that's one of her
previously.
passion, decriminalizing drug use. Yeah, and I do feel that she's one of the leaders that women leaders that I really look up to. And I hope that I can even be a quarter of what she is already a big achievement to me, because that's how big she is for me.
Yes, yes, she is a big name to be reckoned with. Definitely, I totally agree with you on on that one. But let's look at a big picture prediction, right? So if you look at a big picture prediction, where do you see women leaders in the coming years for Malaysia?
I do
What's
want
the
more.
future like for women leadership in
I do
Malaysia?
want more women leaders, more young women leaders to take control of policy making in the country. I always feel that a lot of policies are not really fail. I mean, like, doesn't really fit what women needs in Malaysia. What doesn't They don't look at the what Malaysian women needs, because the ones that doing the policy is not women. That's what I feel, because although
Give me an example.
like
What's
when
bugging you?
what currently
What's
bugging me,
bugging you
um
in terms of
the
policy, in terms of, like what would you want changed? Or what's a good example that was done for women which was not beneficial? Something along those lines.
mm, um I I think the sexual harassment law is still not. I do feel that that is something that it should be a prioritize, even if the parliaments are closed and whatnot.
Yes.
It should. And it's really disappointing. It's something that would keep Malaysian women safe. So I do feel that if we have more women in ranks of who are in the policymaker, among the policymakers, or they can actually fight this. To me, right, sexual harassment affects a lot of people, a lot of women, not even only women, even
Yeah.
men,
Yeah.
from all walks of life. So having this law like
Yeah.
hanging, and I that's really disappointing to me as a woman. And
Probably the other one is your child marriages.
yes,
Mm.
that's another thing that really irks me.
Yes, yes, I'm very sure. Yes, we
uh,
are we
we,
are we are on the same page here. Yes.
because people don't understand how child. Okay, this is my view as a doctor. I mean, like, when you have child marriages, you have women, young teenagers getting pregnant because they got married earlier. And when they a lot for they don't a lot of people who got married earlier, they don't really understand how pregnancy is. They feel that, oh, marry, you really get. And then when they got pregnant and then had to raise a kid, and then just they finally hits you that, oh, I'm 18 years old and I have a kid already, and I cannot go out have fun. And then because a lot of these girls who got married earlier, I'm not saying that all of them are not
Right.
mature, but a lot
Right.
of them are not.
I'm not
They
mature.
just thought that they get married because their parents tell them to. Their parents tell them they have to. Or, oh, I love this guy so much, I want to get married now.
Yes.
So I do feel that we shouldn't encourage this, honestly. And I do feel that there should be laws. And a lot of these girls don't really know what they got into when they get married. That's what I feel. So that's why I feel that child marriages should be outlawed. uh,
True, I agree. I totally agree with that. Yes, definitely. Doc,
I
moving
think
from
recently, right, we have
yes,
this single mother of like 10 children. Then I realized that she's a teenage bride.
right,
She
yes.
got married quite young.
Yeah,
So
15 years old or something, 14 or
yes,
15 years old.
I
Yes,
was like, no wonder that she cannot work. She most probably didn't finish school.
yes,
And I don't know, it's such heartbreaking for her to be in this current situation. And
yes. And it was one kid after another kid after another kid.
yes,
Yes, yes.
and there's no way, and her only job that she can get is like being like helping
Domestic.
a
Yeah,
restaurant and whatnot. Yeah,
correct.
obviously, if you don't have education, right?
Education.
What?
Yeah.
So I do feel that we should have mandatory education for at least until SPM. So I feel that if we can outlaw child marriages, because a lot of people who got married earlier, right, they don't finish school, and
Cool, yes.
yeah,
Yeah,
that's that thing.
but you looked into the crystal ball and you have chosen these two, which is obviously your child marriages and sexual harassment. So moving from a crystal ball to a magic wand again, and for women, right? For if I'm saying, I mean, just now was your vaccination. That was your wish that you wanted to give everybody. But from being a woman for women, if I were to give you a chance, what would you hope for? For the future of women, for the betterment of women, what would you hope for? What would you change besides the minister, of course?
Can I want to change the government. Oops.
No, I just gave you that, that push to say besides the minister, and you were one step ahead of me to say you want to change the entire government.
Because the
So
problem is not just
I
one
salute.
minister. I feel that
Exactly,
the
exactly.
whole um what honestly um I don't think that there's any magic spell that actually can reverse what uh train wreck our current
Yes,
situation is.
yes, definitely.
Um
That's why I'm giving you a one to move forward. So,
uh,
you
how
know,
far we can move forward.
wave the
Uh
magic one and you change an entire government. Okay, that's a good one.
yeah,
Yeah,
but the thing is, right, I feel that I still don't feel there's a lot of leadership on either side.
right.
Honestly, that is the most disappointing part that I feel the current situation is, and I feel that a lot of people who have very good ideas being left behind or
Mm,
ignored
mm.
just because what they are asking or doing is not popular, is not really profit making, and it's really disappointing because these people really have very good ideas, and most of them end up trying to set up NGOs, trying to move forward with
Yes,
whatever they. So I do, but at the end, right, as a governmental organization, right, there's a limit of what you can,
correct.
because the policies is
Exactly.
still being made by the
Yes,
government, and no matter how much we lobby them, it
yes.
still depends on whether they actually agree as a majority, and that's why my first thought was change the whole government. Uh,
Yes, I salute you. You were very, very quick to answer on that one. So yes, so I then can
I'm
sense.
a civil servant, and it's like I'm not supposed to have political views.
Yeah, that's okay. Today is on a personal note, so that's all right. And you're on a non-political platform, so
Okay.
you're very, very safe, right? Yeah.
Yeah.
But Doc, we have just very, very few minutes left, and I would encourage everyone to start turning on your camera so that we can get a group photo. But meanwhile, Doc, in closing remarks, right? A few important ingredients um, moving forward. What's your advice? What's your parting words? But like what can we take back saying it's Dr. Ida's advice? Something for us to bring back and say, look, this is something that I can take away. This is something from somebody I'm looking up to personally, even for myself. So a few important ingredients as we move ahead.
I honestly feel that for the current situation, right, no matter how bleak the current situation is, maybe we still need to see what is the silver age of this uh, cloud that we are trying to navigate through. I do feel that that is the key thing for to let us survive this challenging period, and always view, I mean, like always have hope, and believe in our fellow Malaysians and ourselves that the current situation is not permanent, and there are change up ahead. And I still I hope that people can share more this kind of message that is the current situation is not that bleak. We can go beyond, move on, move forward, and um, and don't be fixated with what is lost and try to move forward as positively as we can be. So
Right.
that's
So
what I
yeah.
wish for everyone.
Okay, so find the silver lining, right,
Yes.
in the cloud, and move forward as positively as you can. And it's really, really not the end of the world, but try to
It
look
does feel
for.
like one though.
Yes, especially last year, I will tell you that a lot of people felt that it was coming to the end of the world. People were saying, don't need to save money, go and spend. But want to spend also don't know where to spend. Everything
Yeah.
tutup and you couldn't go anywhere, and things like that. But having said that, we are a very resilient bunch of people, and we survived, and we will continue to survive. So I think, yeah, so these are good things that I think we need to hold on to what you just said, right? So for me, is I think like what you said, find the silver lining at the end of the cloud and look forward, and look at what's positive. Try and find all the little opportunities that we can, and and just be appreciative, I think, because like what you said just now, don't always look at the glass being half empty, but rather look at it and say that the glass is actually half full. So while waiting for the rest of you to please turn on your cameras, Dr. Ida, I thank you so much for coming on board, spending 1.5 hours with us in Tulips. It was an interesting talk for me, who did not prepare a single question. So it was really, really very, very good. On behalf of the Tulips movement, humble appreciation. Thank you so much for sharing, the time, the advice, and having a very, very good chat with us. We understood more on what's happening behind the scenes. We understood what's happening with the hospital, your advocacy towards vaccination, and don't just look at the numbers. Let's all stop talking about the numbers,
Yes.
but start getting a little bit more
Vigilant.
self-aware, and practice social distancing, which we know is going to be not for another 1 or 2 months, but probably in years to come, until at least we hit the herd immunity, that is,
I hope with
right?
more vaccination, right, we will reach there. When
Yes.
we will come back having like face-to-face interaction like we have before, and make it a better, safer place to be.
Okay, so before I pass it on to Nora, you have heard Dr. Ida's last words. Before me, Alia, signing off, I would less like to tell you, you've heard Dr. Ida's last words, all her good suggestions and her good antidotes for you to take little nuggets that she has thrown in here and there. And from me, my last words is, don't forget, pay it forward. Selamat berpuasa from all of us at Tulips to each and every one of you. And be a badass with a good heart, soft but strong, unapologetic, and above all, honest. So this is Alia signing off, and giving it back to between Nora and Hui, my Tulip sisters. Thank you again, Dr. Ida, and let's get our group photo.
Okay, thank you, Dato. Thank you, Doctor. Okay, let's everyone look at the camera, laptop camera or phone camera. Okay, first shot, 1, 2. Okay, I'll just wait a few. All right, 1, 2, 3. Okay, I'll take another shot. Hang on. Okay, one more. Take 1, 2, 3. Okay, thank you.
Thank you.
Thank you for the opportunity, Alia. Thank you.
Most
Thank you, Dr.
welcome, Doc. I'll chat on WhatsApp with you. Send you some photos. To everyone who has followed us today and who's watching, thank you very, very much for joining us. And follow us on our Tulips LinkedIn page and also on our Facebook. And until we meet you again, this is Alia signing off on behalf of Tulips. Thank you, everybody. Bye-bye.